morning to those who are joining us from Singapore and Asia, and good afternoon or good evening to all of you joining us from other parts of the world. Thank you for being here with us for today's online event on the growing health tech market in Southeast Asia, presented by SGInnovate. My name is Jin from SGInnovate, and as a Singapore government-owned organization that invests in and helps build deep tech startups, talent, and community, we have been building up and driving deep tech innovations in AI, healthcare, quantum tech, agri-food, autonomous technologies, just to name a few. At SGInnovate, much of our work is to connect Singapore with the global deep tech ecosystem to learn how we can better harness technology. Today, we have our panel of experts from Southeast Asia joining us to discuss the rise of innovative health solutions in the region, explore the potential for corporate startup collaborations, and how we can build strong partnerships to maximize innovation and adoption of health technologies in Southeast Asia. Throughout the session, we encourage you to engage with our speakers by submitting your questions in the Q&A box located on the lower panel of your screen. So without further ado, I would like to invite our moderator for this discussion, Dr. Monica Mittal, to start us off. Monica, please.
Thank you, Jen. Welcome, everyone, and thank you for your time today. I'm Dr. Monica Mittal, and I'm Innovation Lead at Access Health International. I would be moderating the session today, and the topic of our discussion is the growing health tech market in Southeast Asia. Southeast Asia is home to 855 million people, about 8.5% of the world's population. According to WHO study conducted in 2017, the people about the age of 60 and above were about 10% in 2017, which is set to rise to 14% in 2030 and 21% in 2050, respectively. The increase in aged population would definitely increase the demand for healthcare services. Current COVID crisis has already put a tremendous strain on healthcare services, and we see many healthcare systems crumbling. Massive rise in healthcare needs is one of the greatest challenges the Southeast Asian nations have seen, and yet there lies a great opportunity. Health technology could address this gap in forms of new technology, new process innovation, or even partnerships between governments, corporates, organizations, developmental agencies, and startups, among many others. We have a distinguished panel today who would be discussing about the innovations and the challenges for growing health tech market in Southeast Asia. Before I pass it on to the panelists and continue with our questions, I would like to remind, please put your questions in Q&A sessions, as we as panelists would be answering the Q&A sessions towards the end of the session. I would now like to invite Miguel to introduce himself, his organization, and also speak about what were the innovations that he has seen in the past 2 years addressing patient accessibility and affordability. Over to you, Miguel.
Thank you, Monica. Hi, everyone. So my name is Miguel. I'm responsible for a function that we call business model transformation for Novartis Pharmaceuticals. It's primarily focused on the digital transformation inside of the company, but also the partnerships that we build with health tech startups, public institutions, etc. Right? So I'm very much at the core of the topic of today. Very happy to be here. If I jump straight into the question, so the past 2 years, we've obviously seen an acceleration in the digitization of health, right? I would probably highlight two things that have accelerated and, in a way fitted the COVID crisis for the healthcare systems, where we really saw an acceleration inside and outside of our environment. One would be remote monitoring solutions, because healthcare systems had a big need to keep patients away from hospitals, keep quality of care, but in a remote setting, hopefully keeping patients at home. So that drove a lot of enthusiasm in our case. But it's important to note that we needed to do that at the same quality of care, or very close to a hospital setting, right? So it's not your Apple or your Fitbit type of monitoring, right? It's a different standard. And the second one that I also saw, and I think it's part of a larger trend of patients taking more ownership of their health in the region. and it would be telemedicine or teleconsultation, right? Again, driven by the need of remote connections. But I think it tapped some opportunities on even making healthcare systems more efficient, right? Things that were piloted or trialed out, or maybe systems were a bit resistant, even healthcare professionals, patients were resistant around it. Slowly, just as we adopted to running our work lives through Zoom, patients and doctors adapted to doing their practices through telemedicine. I think that's going to stay for the long term.
Thanks, Miguel. Justin, may I invite you to introduce yourself and also speak a little bit about your organization, and also address the question, what are the innovative solutions you have seen in the past 2 years for patient accessibility and affordability?
Yeah, no problem. Hi, everyone. I'm Justin, Chief Marketing Officer at Whitecoat. Segue from Miguel, actually. So Whitecoat is actually the leading telemedicine service in Singapore that essentially allows you to video consult with a doctor on your mobile device, literally anywhere you might be. So we're also very much an end-to-end service that covers medication prescriptions and fulfillment, with medical documentation all provided in our app as well. So on a day-to-day basis, I actually oversee and manage go-to-market product launches, cross-channel marketing, and process planning. My team and I work on developing branding and marketing strategy, with the eventual goal of actually building awareness of personal health and telemedicine in the country through both education as well as trial. One of the key things that we have placed a big emphasis upon is actually the accessibility as well as affordability of the solutions that we're providing. In the landscape today, as we see rapid decentralization of healthcare taking place, essentially moving away from key centers of care and into patient homes, as Miguel had mentioned earlier, it's actually very apparent that healthcare needs will continue to be addressed by medical and healthcare innovation. The market will always keep up, and that's actually pretty much a guarantee. What's now just as important to acknowledge is the underlying infrastructure that supports last mile logistics and data access. You could actually almost see the shift of burden of care transition from conventional healthcare providers to players that have actually been typically in the periphery, players, for example, in logistics and mobile data sectors specifically. So to sum up, in terms of innovation, right, we're looking at actually at the convergence of medical as well as non-medical innovations that now lead the way in serving those that live possibly in rural as well as urban communities.
That is a very good point you made, Justin, here, that convergence of medical and non-medical facilities in both rural and urban areas. And we would come back to that later in the discussion. Now I would like to invite Alan Tan to introduce himself, speak about himself, organization, and obviously about the innovations he has seen in the past 2 years in health tech sector.
Yep. Thanks, Monica. Hello, everyone. My name is Alan, and I lead the business analytics team as part of the group data initiatives at IHH. So we are responsible for developing data use cases across the group. One of the things, of course, we recognize quite early on is the importance and the value of data and how to use data to deliver value back to our patients. Right? I think I echo the same sentiments as my fellow panelists in terms of some of the use cases that we're seeing in the market. I think going at the health value chain, so obviously coming from a healthcare provider, I mean, we have definitely seen telemedicine taking off, remote monitoring taking off, and we also started seeing convergence of medical and non-medical, as Justin shared. But one of the things that we also seen as going up the health value chain is we start seeing more emphasis on other aspects of care, right? We talk about mental health, right? And there are also other aspects where now even gym apps, right? They are getting very creative in terms of how, given this COVID restrictions, how people are being able to continue exercising and living a healthy lifestyle, right? So those are things that we definitely have seen in the market. Now, the one thing, of course, as a healthcare provider for us is where do we fit into this ecosystem in this picture? How do we manage the continuity of care between different players as part of this ecosystem? So I'm sure that we'll talk a little bit more in terms of some of these challenges, but these are some of the areas that we are seeing in this space.
Yeah, and thanks, Alan. And I see health hospitals as being the core of the innovation, because they are the ones who are providing healthcare services. And I would definitely come back to the data point. I would now like to invite John to introduce himself, organization, and obviously please shed light on the innovations that he has seen, especially in Vietnam, in patient accessibility and affordability.
Good morning, everyone. It's been a pleasure to be here, and I'm very excited to talk to you and bounce the idea forward together. And thank you, Monica, for giving me this opportunity to speak on my behalf. I also like to say thank you very much to the organizer, and I also mentioned that I'm pretty excited to meet Justin, Miguel, Alan to talk and different other ideas. So what I'd love to listen to you during the conversation. And I would like to say good morning to all the attendees. I see that there's more than 100 attendees over there. So I'm very excited to share the idea. And yes, any questions, we'll love to put our brain together to answer. So myself, I'm John. I did a couple of multi-billion-dollar business transformation as a CIO. One of them is the Hoa Minh Medical Corporation. It has 16 hospitals and 6 clinics all over Vietnam. The corporation is serving 4 million Vietnamese patients in a year. So in terms of the market share in private sector, it's the #1 and most dominant one. And another transformation I did is about an education that is for RMIT University. But as this is more about health and medtech, so I'm going to focus a little bit about what is for my transformation work in Hoa Minh Medical Corporation. So as a CIO, I was leading 150 people to do the digital transformation. And then after a year, I was taking the second role about director of transformation. I was working on passion experience, continuous improvement, passion flow, cultural, company corporate cultures, and continuous improvement and medical skill sets and so on. So in terms of the change, we see this one, the COVID took a lot of life, but it also gave a lot of things, because everything has a two sides of the coin. So COVID also initiated a lot of other key aspects in the hospital too. A lot of the hospitals was been really understanding about before. I'm a very much positive-minded person, so I'm going to talk about more about what is the great thing we got from COVID and how it's really helping us to shape in healthcare so we can make this world more healthier and bring more people to more healthy state. So number one I will say is this, is before in the hospitals, technology was most about the time is about X-ray, ECGs, and bit of software like HIS. But after it became the COVID, a lot big changing happened to realize the importance of data and the whole care to give the care of healthcare outside the hospital start to happen. So there's a few other panelists were saying a couple of initiatives. Miguel was saying about, Alan mentioned a few of them, but ultimate goal is about giving the care outside the hospital, not in hospital. And that's where the biggest opportunity for providers or investors who are working on healthcare model to provide care in a bigger, much more scale, because it's not about the only quantity, but also scale, how much scale is there. And that's the thing. The second thing I see shifting to change, the investment on technology is significantly involved, increasing after because of the COVID in healthcare sector. But I think that it's still not even close to enough, which I will be talking more a later part of this conversation. I'm talking more about Vietnamese perspective because I'm speaking from Vietnam, not Ulmer speaking for a Singaporean perspective. Number three is a capability development in IT and digital initiatives. Was way less before, but now organizations start to focus about, now we need to have more capability, not just an outsourcing and software agency. We go for Microsoft or go for Google and tell them to come in and do everything. It doesn't work that way. Last few years, hospitals spend a lot of money on that one, but it didn't really help them, a lot of hospitals, to have a true digital transformation or organizational transformation in terms of technology. But now they realize, oh, we need to have capabilities. And a few mentioning about Miguel is about telehealth. Yeah, so platform development like telehealth, remote consultations is definitely an opportunity, but the things are much more valuable come to the play in the ground is about a lab centralization, radiology centralizations, RPA solution to implement a different kind of remote ECG machines and X-ray machines and centralizing the report in one place, because Singapore is very small. I mean, I'm just talking about the geographical space, not talking about economy. So please don't take it otherwise. Singapore is very small. It's not like few couple of districts in the downtown in Vietnam, in Ho Chi Minh City. So with that small aggregation, it's very easy to do it. But in Vietnam has 100 million people with that amount of scale, with that amount of scale. So there is a true business opportunities there. There's a few opportunities was been taken, but there's a few opportunities not been taken, which I'll be talking later on of this conversation too. So I think I should stop and let's keep going on. I think there will be a lot of ideas coming in. There's a few other questions coming from Monica. I'd love to discuss with you guys. So yeah, like I said, that thank you very much for joining this sessions, and I'm looking forward, pretty excited to continue my conversation with all of you.
Those are very good points, especially where you mentioned about taking care going outside the hospital, and that fits very well into teleconsultation and remote patient monitoring and centralizing that data in an ecosystem where everybody, doctors can efficiently manage it, and obviously increased investments in technology, especially towards healthcare. I see that we see a lot of investment happening in health tech, especially in telemedicine recently after COVID. That brings me to my next question of to all the panelists of how do you see, based on teleconsultation, telehealth, remote patient monitoring, we would be collecting a lot of data in terms of healthcare and patient data. How do you see these data to be utilized in a way that that can allow hospitals or all the stakeholders to provide care more efficiently, and at the same time be aware or mindful of data privacy for the patients? Maybe I can, John, why don't you go first, since you were the last one last time?
All right, I'm happy to go with this one. I think that there's a lot of exciting thing going on right now. So there are a few things about data collection and who is willing to data. So I was reading quite of interesting insights from Deloitte a couple of days ago. So because of the COVID, so I'm a very positive person. So I will always see the bright side of it, and every challenge I see as an opportunity. So COVID, I never see it's something only just, it's a sad thing, but there's create a lot of push for make people realize that we need to make this world a better place. We need to prepare better way in the next pandemic. So you probably know that the TED Talks, which Bill Gates gave like a few years back, he exactly mentioned about this pandemics, and he mentioned that we're not ready, not even close. And we actually proved our humanity, we proved ourselves that we're definitely not ready. And that's why we're losing so many lives. So what was happening is Deloitte Insight, which I was just mentioning about, is there was a few years back, and now people are much more willing to contribute data without concerning about privacy issue. And last year, it's due to COVID, people are 40% more likely to give inputs to the data. So which is a lot of leverage and opportunities for our organizations or healthcare provider to really build the right solution into that one as well too. And so when it comes to that one too, I will say this data as you're coming into place and how it's the security and security it's kind of like a brand. I mean, it goes with a brand. If you take the data and you feel like a play around like a high school kids, which most of the organization did actually, with due respect, they lost the data, right? Anybody get hacked? They did not put in the right server. They did not do the right patching. And another worst thing they have done, they just stored the data in a storeroom and forgot to lock the door. So anybody will open the storeroom and just took the data and gone. And then we find them in a hack website. So those data really need to be protected first. So it will be, so people will be more comfortable to contribute for the data. And people always, another wrong strategies about is this. The thing is, most of the time now, the business strategists think that our customers are less educated, but actually not. Compared to 10 years back, today our customer is way more highly educated and more conscious about the data and what they contribute about, what they care about, what they pitch about. They know the thing, and and just like an example, like a platform like YouTube, like it's such an amazing like university. People can learn anything even just using YouTube's. So so people are much more well educated. So to get such an educated people to contribute their data, somebody really need to have the right policy and the right communications. And when they input in that one, then have to be really process that forward to create a win-win situations, what they're going to do with the data. And that's where is the issues, because most of the time business strategies come to just win and lose strategy. And that's how it's become a disastrous matrix. And it doesn't really create the right branding and right impression, and they lose the game. But unfortunately, most of the organizations in the hospital chair, they have not really realized that they have to give into an infinite game rather than a finite game, which is like you come and win and somebody to lose. But everybody can win. That's why a big corporation didn't really invest in enough time and resources to build something like an AI for good. No, there's nothing in Vietnam so far. There is no opportunity. There has not been built for about machine learning or building solution for a PPP project with the governments. Nobody have an approach until now too as well. So there's a lot of like exciting things need to be done. There's a few of the things that's been done in Singapore in a small scale, very small scale. But now bringing some of the thing could be tested in a larger scale. But like an example, when you have to start playing with data, very first thing we need to get it right, that what is the purpose and what is the win-win relationship? Otherwise, nobody will contribute. And I think that there's other panelists have a lot of other ideas too. So I would like to give other panelists to go on and add them, because I don't want to cover all of them.
Thank you, John. Thank you, John. Those were really good points. May I invite Alan to speak on this, since he's leading data analysis for IIH Healthcare, and how they see this as a challenge and opportunity.
Yeah, thanks, Monica. Thanks, John. I think I echo a lot of what John has said a little bit earlier, but maybe let's add a bit more color. I think in terms of challenges, I mean, data is data, right? It only becomes useful when you're able to convert it into information, right? And it has to be useful. So one of the challenges, I think, on the operational side is, while we're collecting a lot of this data from remote monitoring, it's then being able to make sense of it, right? Some of the feedback that we have actually received from our doctors is that actually there's too much data, you know, and it's difficult because sometimes when we look at the data that the patients are reporting from home, right, what were they doing, you know, in order to get this high blood pressure reading? You know, were they doing some strenuous activities? What were they doing? So there's a lot of noise in the data, and then being able to get a baseline that you should be able to use and compare, and then to say, hey, is the patient's condition deteriorating? Now, the objective, of course, is that we want to be able to move some of this care out of the hospital so that the hospitals can be freed up to focus on more critical cases where cases need to be in the hospital. But at the same time, when we are talking about, like, say, for example, chronic disease management, right, there are certain examples which we can definitely move it out, you know, and say that, okay, our GPs can take care of it, our GPs can follow up and monitor. But even then, our GPs will say, look, I have a limitation because there's a lot of this information on that I'm seeing, and I'm not sure how to integrate it. So I think there's a lot of work that still needs to be done. One, of course, is you could leverage AI to help in terms of to complement some of the analysis and provide that analysis and insights back to the doctor to be able to make that determination. Then I think data. I think one thing that John did mention that I thought, you know, very interesting is true. It's true that in this current situation with COVID, people are more willing to share data. Right, and this I say this also because when we first started our tele consult journey, which was actually almost more than a year before COVID even happened, right? There were a lot of resistance and pushback because a lot of people didn't understand the technology, and there were questions like why even do this? What's the upside to doing this? But when COVID came, and then, you know, suddenly those questions went away, right? And certainly, you know, there are still questions about data privacy, data protection, and those are still valid questions that needs to be addressed, right? So it falls on both the business as well as the partners who are providing the solution to be able to come up with a secure platform where data is collected, you know, to a certain extent that it can be used for its intended purposes, right? So those are there is an onus, and of course, those are things that still have to be worked out. right? And certainly some organizations have gone different ways. You could develop your own solution so that you make sure that all the data is within your ecosystem and you can protect it. But that means that you're going to grow very, very slowly, right? It's a very organic growth. Then you can work with many of the other partners out there, right? In terms of telehealth solution. But then the question comes is, okay, so in terms of this data ownership, how does that work? Does this belong to the platform, or does this belong to the healthcare provider? Whose responsibility it is to take care of that data, right? So this becomes a bit trickier, and certainly it's still something that businesses have to discuss and get an agreement on. So those are some of the challenges, of course, with solutions like this.
Yeah, I can see that the data that might be collected might be really, really huge, and it might be very difficult to make sense of it. And I agree with you. There's still a lot of work to be done. But I would like to first hear from, again, Justin, as in how they see, as a telehealth company, the data they collect, under whose ownership does it goes? What other policies do they follow?
Sure. I think from the telemedicine's provider's perspective, it's important to recognize the significance of data in our business model. I think for sure the responsibility and the burden of care in terms of collection of data resides with the party that the patient is interfacing with. In our case, our service, right? And I think the ability to protect the patient's data is of course critical in ensuring a sustainable experience that the patient is going to have, not just one time or two times, but for the long term, right? But we've actually taken a very different perspective in terms of understanding how data can benefit our business. I think for a start, we've looked at implementing data analytics in an optimization capacity that improves essentially the overall experience of using remote healthcare services. That includes, for example, dynamic onboarding and offboarding of our doctors that reduces queue times. So we are able to essentially comfortably predict when patients are going to be coming onto our platform based on historical as well as trending data, and optimize delivery timings, as well as removing choke points that create barriers for customers to use a service like ours. That means that they receive medication more quickly. And we've actually come to realize that it's even these little things that matter when it comes to driving a better, for example, patient outcome. So moving forward, I think we're looking at it on a more macro level. We're looking at how insights can transform the business model from a service that leans towards very prescriptive solutions. I think that's actually a typical characteristic of healthcare players in the market today. It's very prescriptive. If you're unwell, you see a doctor, right? And into something that's more intelligent and more predictive. A solution that, for example, is able to triage a patient even before they see a doctor, that routes them to the best form of medical care, one that helps doctors arrive at more accurate diagnosis, right? I think the burden of utilizing this data, again, is not resting on a single organization's shoulders, right? As we know, the healthcare journey should be one that is seamless, one that is able to transition from form to form, regardless of the number of service points that a patient would interface with, right? And so the intersection of all these different data points throughout the patient journey is actually very important. The flow of data is just as important, right? Where the patient is able to transmit data from one end all the way to the other. So I resonate very much with what John and Alan had said about patients being more receptive, more willing to provide data that is essential to their own healthcare needs in this pandemic age, right? I think actually that's a massive opportunity for the industry as a whole to build on such a sentiment, right? Where we can now look at unifying possibly various healthcare systems as well as data transfer from organization to organization.
That was one of a very good point you made, that utilizing that data is not just the burden of one organization, but it is across all stakeholders, because healthcare is not in silos. It's a continuous journey and across with all different stakeholders, from payers to providers to patients itself. I would now like to ask Miguel about it's a global organization, and how do they might be using data for a very, very long time, and they might have some policies already in place. How do they go about now when people are more open to share more data? And I'm sure they might have some partnerships or policies already in place.
Sure. So I think I'll start by saying that healthcare is not consumer tech, right? I believe that many worries around data in today's societies come from the practice of mining data for the purpose of selling ads, right? And we are not in that business, right? So I can see a strong value proposition for any patient or even healthcare systems themselves on sharing health data, because the objective will not be to monetize it, right? It will be to help people achieve better outcomes, right? To find insights and hopefully take some action around it, right? So maybe I'll share one particular case where we started to help healthcare systems with the use of data, right? So we've been saying that data is pretty silos in today's world when you think about healthcare, right? And what we've been doing in some cases is we're taking an active role on partnering with particularly hospitals into looking at data in areas where we have a good depth of expertise. So for example, we have a lot of expertise in cardiovascular and metabolic diseases, and not only the disease itself, because we developed compounds to treat them, but also how are diseases treated around the world, right? So we understood now, where are the areas of opportunities for a clinician, a clinic, a hospital network, or even a Ministry of Health to improve certain outcomes, right? And by the way, this has no connection to our own products, right? We do it with the sense of helping achieve better outcomes for patients on that particular disease or therapeutic area, right? So by looking at data, and this was nothing fancy at the beginning, right? It's just like having conversations, convincing or connecting with people to share data, and then look at it together, right? And we were able to find places where areas of opportunities where, for example, if a particular hospital applied a protocol that we learned was very useful in another hospital, we were able to predict the outcomes that they would get, right, with fairly good accuracy, right? We would basically tell them, for example, if you hired one more nurse and that nurse did X, Y, and Z, you would not only get better outcomes, but very likely you would lower your operational costs, right? And we're trying to use data in a way that it's meaningful for the different stakeholders in the system, right? Because this same model has a different value for the nurses that are on the ground floor, where you can maybe tell them you can have an extra hour on your day, or you can have very quality conversations with your patients, to the manager of the hospital, right? Which is maybe looking at cost allocation, cost reduction, etc. Right? But at the end, when you have a full visibility of that, I think really good opportunities start to emerge, right? The challenge really today is still getting everything together, right? And these things that we've been starting to do are still fairly manual and built on many connections and trust with different players. And hopefully that starts transitioning into a more automatic, AI-driven model where the value could be extracted faster.
That's thank you, Miguel, for sharing that. That's an amazing example of how data can be used about how the time a nurse spends and how hiring one more nurse can reduce the burden on the rest and also reduce the extra additional cost or in total of a healthcare ecosystem. That's just one example, and I'm sure data as itself as a rich mine of more examples of how we can reduce further healthcare costs. That brings me to my question, and our discussion has been highlighted so far that teleconsultation has been the innovation, and people are more willing to share their data, and there's more data collected. Then what is the challenge? One challenge you see in scaling this across different geographies in Southeast Asia, in terms of anything, it could be in terms of policy, in terms of investment, in terms of data, like data we have already spoken, but about reimbursements, about the regulations which you want to address today. And I would like to go first with Alan. Alan, any thoughts here?
Yeah, I think the most obvious one will be regulations, right? So when we're trying to scale telehealth or consult solutions across geographies, so maybe I'll share from one experience, right? So when our borders closed, a lot of our foreign patients could not come into the countries for treatment, right? So they could not follow up with care. Now, certainly teleconsult presents an opportunity for them to be able to continue to be able to get their questions addressed by the doctors. Of course, there are physical limitations, but they can at least still say, oh, they can still have a consult with the doctor, say how I'm feeling. But the challenge, of course, after that is, it's then if let's say the doctor says, okay, you need to get certain XYZ medication, right? But I'm a Singapore doctor, I can't prescribe it in your home country. So how does that work, right? So certainly regulations will be a problem, and I think that's something that it will still require a lot of work before we even get to a day where we can have some cross country kind of consultation. But the idea, of course, then is teleconsultation becomes a platform to be able to enable that. Now, I think in terms of regulation is one. I think reimbursements is another issue, of course. Certainly, how does the cost of care get paid, right? So that's something that. But I think definitely regulations more than reimbursements, especially if, let's say, you're seeking treatment of care from another country.
Yeah. Thanks, Alan. Justin, what are your thoughts on this?
Actually, I completely agree with what Alan is saying, right? Regulations, I don't want to elaborate too much on that. I'm sure we have many perspectives on that. But I did want to talk about reimbursements, specifically who's the payer when it comes to provision of healthcare through teleconsultation services, for example, right? And I think one of the biggest challenges that we faced 2-3 years ago when we started the company was who was actually going to pay for the trial usage, who was going to fund the initial experience for users who were going to be skeptical about the teleconsultation model, right? And I think one of the big conversations we had was, are we going to work with an insurer, for example, and which insurer are we going to work with, right? Because that actually gave new users who are coming into a digital ecosystem the impetus to try a service that typically might not have been conventional before, right? And I think that challenge has been a tremendous one for us in educating as well as operationalizing a reimbursement model for remote healthcare services. Today, I think we stand as one of the first telemedicine players in the region to work hand in hand with an insurer to provide that service on a covered, insured basis for patients that are actually looking to utilize a remote solution in the face of the pandemic. So it's actually very interesting for us to understand how behavior has changed as well. As we were talking about earlier, the conventional healthcare model has shifted from being in hospitals to being in patient homes, right? And the whole idea of remote services is how we can drive the adoption of remote technology. Again, to Alan's point earlier, as the borders started to close at the start of the pandemic, we realized that patients were calling us from overseas. Patients from all across the region, all across the world actually, were calling us to utilize a service that meant that they could see a doctor from the comfort of home, And I think the challenge then, right, goes back to things like the dispensing of medication, the different regulatory policies that exist within each market, And there were a lot of make-dos that we had to put in place to ensure that we were still delivering the best form of care. You know, in the least ideal circumstances, we were even writing referrals to other healthcare institutions and organizations on behalf of patients to ensure that they still received the best form of care in their home market. Now, of course, in Singapore, it's a different story, right? The state as well as regulator-led initiatives have actually built a very robust process that allows for escalation of medical care, for example. So just to share one particular example, when we suspect a patient to be displaying symptoms of COVID-19, we actually had a formalized process that involved escalating them to elevated forms of care, arranging for ambulance and emergency services to ferry them to the nearest physical facility, and then undergo testing to ensure that their statuses and their diagnosis was confirmed. So these different components, as you can see, these different components actually played a big part in serving the community, where multiple organizations had come together to develop what was essentially a service that was put together overnight during the pandemic period.
Yeah, I totally agree that we have seen some amazing examples of how crisis can move humanity in terms of bringing innovation together. Earlier, which was a challenge of bringing teleconsultation to doctors itself, now people are moving to bringing everything in one place, right? From physical facilities and ambulances, and we have seen that strongly in recent times. Miguel, what is your experience in, or what do you think could be one of the biggest challenges in terms of scaling this innovation, which COVID has shown us could really survive?
Great question. I think a lot of it comes to simple traction, right? To me, regulations are a reflection of the status quo, right? So regulation is always trying to catch up with innovation in a way, right? So I mean, not to say it's nothing to worry about or nothing to not take into consideration, but regulations will always catch up, right? I think the important challenge is on making this innovations business as usual in their day-to-day practice, right? Because when you look at a day-to-day of, say, a clinician, a nurse, a patient, there are changes that need to happen, right? Following the telemedicine example, instead of going into my office as a doctor, I might now sit in front of a camera, right? And my day will look probably very different, right? Because maybe I will split my day between, and I'm making things up, right? But maybe I will split my day between consulting my overseas patients through telemedicine and seeing my local patients in my office, right? And that's habits are hard to break, right? So what I have seen as a common thread on challenges on how to make innovation stick is really on creating a habit of this new way of working, right? Of this new way of delivering practice, right? And I made a simple example, but you can think of changing protocols in hospitals, which would require changing some policies in the hospitals themselves, training patients, training staff, etc. All these little steps can add up to the challenges that could bring innovation to scale, right? So it's really up to us. The technology is already there. The innovation has happened. It's really up to us to take it to scale, I think.
That's a fair point, that we have to invest, otherwise we can anytime relapse. That's a very, very fair point. John, may I invite you to speak upon what challenges do you see in terms of scaling the technology?
Well, I was listening to all the panelists. It has been an amazing discussions, and these regulations came in and the practicing of those are absolutely amazing point. But in this part, I'm going to be a little bit bring the different perspective in the table, because I'm coming from a different place. I'm coming from a country which is per capita income $2,500 a year. It's way lower than Singapore. But from Singapore, when you look from far, you think about, oh, maybe they are really sitting in an old age, but actually not. More than 90% people of this country have an internet access. And the second important thing is, well, how this market is significantly different is this. Singapore is relying, talking about overseas passion, outbound passion to come in. But Vietnam is local, 90 million people here in this country. And the geography is so big enough, from, let's say, from Ho Chi Minh City to Singapore, it takes 1 hour flight. From here to Hanoi, which is like another big city of the country, it takes 1 hour too. It's that big. So to localize people there. And the third thing I want to tell about, there's a lot of great brand in Singapore. None of them was ever been successful in Vietnam. I mean, many of the reasons, which I can explain later. I mean, there's a few Rayfield came in, probably just like 5 or 10 doctors they're having it. Before there was the SOS, another catastrophic failure. Basically, Rayfield who bought over the SOS and brought up the few clinics here, and it just probably a few of the capabilities I'm gonna mention about in the moving on in this talk about it. What to really think? I'm gonna be focusing about 5 things which is really be a challenge here. In this, even this is such a big market and big opportunity and big problem to solve. I'm not going to just talk about business perspective, but I'm talking actually about how we can really solve this problem. So the first thing I'll talk about, telemedicine doesn't work in Vietnam yet. Unfortunately, most of the organization couldn't make it work. I mean, none of them can really make it work. Number one reason is this: trust. Patient doesn't trust them. Patient doesn't want to talk to a doctor over the internet. Patients are well educated. They like to do a lot of research about it. They don't want to meet a doctor. They want a human feel. So a year back in a Patient Experience Asia, I was speaking to Singapore a couple of days ago. So there was a big talk about this one. It's about high tech and high touch. Singapore becomes a lot more high touch and not about high tech and forget about the high touch. There was a lot of great discussions was there in that conference. So here in Vietnam, people loves that human touch. So that is, and only that can be tackled if there is a big trust was being built. So there's a lot of things need to be done, which could be another, I can talk about it all day, but I just want to be efficient in this conversation. The first challenge is about patient doesn't trust online doctors. Number 2, capability, which was been few of the thing Alan touched about this one, and also Miguel mentioned that too as well. Capability means the patients have the infrastructure to access that platform, but the doctors are not willing to provide the best experience, the soft skill. The doctor doesn't have it to communicate the right amount of patient experience over the internet. They are they're really good to do a face-to-face great patient experience. But when it comes to the online, they struggle. And I've been working with thousands of doctors. So like an example, in 1Me, there was like almost 2,000 doctors. Before that, I have been interviewing almost 25,000 doctors, which I did in patient experience research in Vietnam ecosystem. So the one thing came around, doctor is one of the hardest smart creation of the world to change when it comes to change management, because they have been programmed to do exactly what it is. If you look at the doctors, who becomes a doctor, who exactly read the books, exactly write down the exams, exactly they pass, and they come to the hospital, they do exactly the same thing. So it's like a exact thing they need to practice, and more exactly you do, you better and better doctor. So that's why the change management is always a challenge. So capability, the first thing is about doctor capability, and the second thing is about the tech system provide capability as well too. The tech companies who are trying to build some system and solution, I've been reviewing them. It's all their solution is about, okay, I'm going to sit down in Singapore, I'll sit down in US, and I'm going to deploy the solution in Vietnam with a very cost-effective lean model. But it doesn't work. Educations of the customers is way more that one too. Customers are really want to see something on the ground really working, and the customer want to buy on some solutions with such kind of like this, which already existing and already give them value. Business later, value first. That's where the company lost the whole market so far. Number 3 is willing to take actions. Many of the company even know, because even myself went to like hundreds of conferences. Like I've been speaking at 200 conferences in the last 3 years of time in South Asia. They know that there's a problem sitting down, that the top executives of those tech companies do not really take actions to make the strategy to realistic. They're always thinking about return of investment or value first, and they always think about return on investment first, and that's why it was a losing game. So willing to take actions and willing to give value first, that was the biggest challenge for the tech companies. Number 4, there was no initiatives about partnerships with the government. Everybody was just thinking about, I'm just coming in and wow the market. It's in 100 million people, I will gain them over. It doesn't work that way. It's 1Me today is one of the biggest giant in this, with 4 million patients care it comes with a partnership opportunity. It could work with the government hospitals, it work with the private hospital, it buy the private hospital, remodel that one too, and deploy the new model on top of it, and do grow very fast the margin acquisition, but also do a lot of partnership development. There's no other one me here. If the second one, if you looked at on private chain, the second one is from a local investor, which like 1/4 of their passions with like 6 hospital or 7 hospital. So willing to take option partnerships and really true investment was missing. So that didn't really happen. Number 5 is about build up the regulations. There is not, this telemedicine thing has not been properly been regulated in the government yet. So few, quite funny. It's last year we had a pretty good scandal, is even Zoom with a Chinese investor. The CEO of the Zoom almost got fired, but we're still using this platform right now in this conference. Everybody give the information. So people know all this information. They will not be willing to, everybody is willing to join a controversial platform. So there is no universal platform was been built in Vietnam for everyone to give, which it can bring the trust, which can bring the brand, and which can bring the real value, not just on money. And it's not just a promise, hey, we're not going to use the data for other cases, but really doing it is a different story. I can say that one, oh, I'm not going to use your data. It's fine. It has no value. Nobody trusts that thing. You got to have it properly regulated. You have to be rightly communicated, and you have to put it on again and again to millions of people. Then the trust will grow, and they really will be willing to value, right? Which platform will be used? Not been regulated. How the data will be used through. Currently, right now, we are sitting down 100 people. Zoom, no, everyone offers contacts right now. So what would Zoom is going to do with this context? We don't know. We can use the Google, but the same problem. Google will get all the context as well. Then Google will know that what we are talking about in the whole conference. So it comes to the security as well too. Then the patients are not willing to talk all those private disease issues. Think about a prime minister of Singapore, or talking about a health issue over the online to the doctor, and then the whole thing has been recorded and been gone to somewhere else. How it will be? It will be the same 4 or 5 years ago what we was in Singapore, where Sing Health was almost getting a punch in the face for opening everything to everyone. So these are regulation is done. So those are the like a lesson for this one. So people are a lot more, government is more skeptical in Vietnam to go to that one. Customer is not willing to join into as well too. So what it needs is the whole thing needs to be properly regulated by regulation, how this platform data and thing privacy will be maintained and the brand will be maintained, and then it will be successful, and which needs good amount of investment, and no one is doing it yet.
Thanks. And thanks, John. There's really quite a lot of points. and for the record, I would like to say that I'm a doctor by my education. So please don't, I would take that a bit offensive. Don't say that doctors are really hardwired. We are quite open to change if somebody is really willing to do the investments in training and skill building, as Miguel has well pointed out. And I appreciate.
I love that. That's why probably you are in this conference having this conversation, right? But I really wish that more doctors will be like you.
Yeah, we just need to make the right investment. So I see that we have almost at the end of the hours, and we have a lot of questions to go. Most of the questions we have answered in some form. It is more about regulations and data privacy. For Alan, there's a specific question just addressing you. You described how data alone is not driving the change, but users need to know how to use it to make an impact. I was wondering, how do you see in the driver's seat when setting out to establish a new data use case?
Yeah, so the answer to this is that it depends. Sorry to give you a bit of a consulting answer. It depends on really the use case in itself, right? So say, for example, we talk a lot about remote monitoring, right? So who would be the driver's seat? Who would be in the driver's seat of remote monitoring? So actually, it's from an administrator standpoint, we'll say, okay, what's the benefit of doing remote monitoring? The real benefit for us is, of course, you get more, I mean, there are two parties that really benefit. Obviously, the patient, because they get more proactive care as opposed to reactive care, because you're not so much limited by the point of care measurements that you only get when the patient visits the clinic, right? So of course, proactive intervention would definitely lead to better outcomes to the patient. But from the operation side of things, actually from the administrator point of view, it is by doing remote monitoring, you then know whether, hey, how often should I see a patient, right? Is it every 3 months? Is it every 6 months? Or can I even see a patient every year, right? So that to me, I think, is where the trigger point comes, right? So from let's say a remote monitoring use case, I would say that it's actually from an administrator standpoint, I would say this is the reason why I would want to do this use case, and I would need to see the data, right? Because the data would not have existed in the first place before you decide on doing a remote monitoring, right? So one of the things you want to do is, okay, how many people have signed up to remote monitoring, right? And are we getting actually useful data? Are we knowing that this is actually leading to a positive change for the patient, right? So, and if patients are receptive towards it, they understand how to use it. Because I think one of the things that I just want to do a bit of a segue in terms of what we just talked about. I think building patient trust is definitely a key, but also education is also a key, right? I think some of us who are based in Singapore, we know, right? Recently in the local news, where we see doctors using TikTok to educate patient on procedures, on why you should, follow up on some of the things that you need to know, right? Do you consider TikTok as one of a reputable, as in a platform for credible information? It actually all depends on the content owner, right? So if the content owners are the doctors and they're sharing their information, but they also believe that TikTok itself is a platform where many of the younger folks who may not have been paying a lot of attention to health are actually using their platform. And so that becomes a channel for the doctors to actually reach out to. So education definitely is a key. So I think one of the success factors for remote monitoring will also be education in terms of helping the patients understand the real benefit of using this. So that's why, coming back to the question, who will be the driver? That would actually be from the administrator standpoint to show that this is the value that we could deliver to the patient. Now, certainly after that, from there, it goes back to the payers, it goes back to whether it's to the ministry or it goes back to the insurers to say, hey, this is the value that we are delivering in terms of managing care and helping to keep healthcare costs down for the patient. So I don't think that we can land on and say, oh, it's always going to be administrator, it's always going to be patient, it's always going to be a payer. I think it depends on in terms of what is the use case that we're looking at.
That's I guess is a fair point too. What's the use case we are looking at would also drive what type of data analysis we would like to do. And I see we have a whole list of questions, and some are addressed directly to panelists. Like John, you have a question, and I would like to pick one question from this and ask the panelists. We have spoken quite a bit about just give me a minute. Agree to use for the teleconsultation. Okay. Is there an informed consent process for the patient to agree to the use of their teleconsultation or remote monitoring data? Justin, why don't you help us answer this question, because you're directly at the forefront of it?
Yeah, sure. In a short answer, yes. I think it's actually super important to help the patient understand what kind of data they're surrendering before the use of any of the healthcare services that they deem to be necessary for themselves, right? One of the key challenges that, to revisit my point earlier, one of the key challenges that we face also is in sharing that data across different platforms. Now, for example, we work with an in-home care provider that essentially mobile phlebotomy that draws blood, provides health screening services. And that health screening report is presented to the patient on the Whitecode app, right? How does that data transfer take place? And is consent acquired from the patient before that process takes place? And so the short answer is always going to be yes. I think at this day and age, even though patients are more willing to share their data with us, it's still just as important to help them understand what exactly we're doing with their data to ensure that they have peace of mind when it comes to using a remote healthcare service like ours.
Yeah, I guess that's important, and going forward, we will see that as a regulation. I would now like to summarize, we are at the end of an hour, and so I would now like to summarize our discussion. It was an amazingly rich discussion where we discussed about how COVID has changed patient perspective and even doctor's perspective to use more teleconsultation, which is one of the more reliable, and remote monitoring as more one of the few innovations, and patients being more aware and educated and willing to share that data, which earlier was not the case. However, this brings us with new challenges of how do we maintain that data privacy? How do we get that data security, which is not the responsibility of a single organization, but across all organizations and all stakeholders? And how do you use that data is again a responsibility of all, so that we can use the data in a way which can address patient accessibility, affordability challenges, as well as decrease healthcare cost for the increased healthcare demands in the future. And lastly, I would also like to say we would need certain uh, more investments, not only in form of technology, but also to educate patients as well as doctors and build those capabilities, so these technologies are not lost in time and can be built on and can be scaled further. With this, I would like to give it back to SGInnovate team to conclude the session.
Thank you, Monica, and also thank you to our panel of speakers for the great sharing, and thank you to everyone in the audience for your ongoing questions. It is always really heartening to see so much enthusiasm in our online sessions, and we do hope that all of you can keep connected. The recording of this session will also be uploaded on SGInnovate's YouTube channel, so do head on there for a review of today's event. And till our next online event, then bye everyone.
Thank you. Thank you. Bye.